In terms of a predictive analytics, in terms of a drug research, is a very open question. It's a very complicated area which require significant investments. And in most cases, when we discuss such type of companies, is about scope of investments like $100 million.
Hello world, this is BetterTech, a podcast where we chat with some of the most successful leaders about the latest industry developments. So join us as we explore the world reliant on tech. This episode is brought to you by Techcell, a leading software development company. Check them out at techcell.com. Today we have with us Yonah Welker, tech influencer in AI and member of the World Economic Forum's Expert Network. So Yonah, in light of current events, how is AI aiding the fight against COVID-19 and how can it help us predict the next coronavirus outbreak?
Yes, thank you so much. Basically, is a huge topic for my colleagues, which I collaborate with, and I would underline 6 main points. First thing, I believe is the main point there we actually failed, because maybe you know that Bill Gates talked about pandemic issues and that we're not ready and that our technology is not ready in terms of a accurate prediction in 2015.
Yeah, I saw that video, yeah.
Yes. So basically, the first thing is a pandemic and healthcare predictive analytics. Currently, we have several companies in this field. Some examples, Blue Dot is a company from Canada, eBioformis. So basically, it allows to analyze information about status of health citizens and population and provide a prediction regarding future pandemia and viruses, but once again, it's exactly the point that we failed. Because currently we need to predict maybe the next wave of a coronavirus, even though summer will be kind of a calm period. We still are waiting for the next wave of coronavirus closer to autumn or maybe winter. So this virus have a tendency to be further evolution and some kind of changes. The next thing is AI for drug research and design. Again, is a point where we actually failed, because as a person who have a chronic disease, I would say that many people around the world struggle to find appropriate medication for autoimmune disorders. And I even don't mention the cases with viruses in pandemic. We simply didn't have appropriate vaccines to the period when it's happened. So companies like Atomwise, for instance, working on using AI to make it better, more efficient, and using AI to predict different combination on viruses evolution in the next wave as well. The next thing is really close to my work and is a kind of my interest, is a collaborative AI or collaborative data science, an open source project for collaborative research. Currently, we have different situation in different countries. For instance, just 5 minutes ago, I had a talk with a person from Kenya. He's a leader of the acceleration programs. He works with startups, and he still have no idea what will happen tomorrow. And the situation in information and insights around the world is different. That's why we need collaborative efforts. That's why we have a platform like Omdena, Zindi Africa, or for instance, companies like a TensorFlow who make a machine learning open source in order to gather insights around the world about this problem. What's called collaborative AI, collaborative data science, where data scientists around the world, technology guys, contribute information about with pandemic in particular country in order to come up with some solution in clear picture and vision of this problem.
Right.
And the next thing, and I believe again was where we failed, it's smart and personalized cities. As again is a part of my work as well. It is a place where we can find companies like Zen City, City AI, and City Biz. Personalized cities is a concept when we are able to gather a lifetime feedback from citizens. For instance, we just found that particular person became infected, and governors have information about this because we have a real-time analytics and board that gather information about every citizens or a particular districts in real time. So AI help us to gather this information and present real-time information very quickly in order to involve health institutions, doctors to this problem, but also make some actions in order to prevent it in the future, to build the cities in more efficient way in terms of access to healthcare. Because, for instance, I spent my mentoring session in Israel, in Palestine, and one of the biggest problems we have today is a lack of access to emergency rooms. Very often is completely overcrowded, and we have no enough analytics about which hospital is available, which places for patients are available. So personalized cities and AI help us to make hospitals and the whole cities more or less clear in terms of information we have. The second thing is open source education and learning to avoid panic. Maybe you know that just in this autumn we have a bit panic about climate change. While this situation exists, is big. We had too much talks driven by not scientists, but more or less kind of activists. Sometimes it led to the panic. At the same time, people need instruction. They actually need information what to do. So for instance, pandemic happens or climate change happens. So what I need to do? So all of us understand what climate change happens. And now we understand what pandemic happens. I need instruction in open source in every country, in every city, when I'm able to access it from my personal account and get some personalized recommendation in my cities. For instance, which hospitals are available, you need to learn this, you need to do this, you better to stay at home until this date. So we need open source information for citizens in order to avoid panic and make our efforts efficient. And the last thing, it's more about prevention. As a personalized and predictive medicine, it's a close point 1 and point 2. So it's related to personalized analytics and healthcare analytics, but also drug research. When we're able to provide people with a quick blood testing, healthcare testing on demand very quickly, while we had a Theranos scandal a few years ago, actually there are companies who tried to bring some quick personalized health testing to the market. And I believe in few years we actually come up with such kind of solutions. So citizens will be provided with some kind of a quick testing of on viruses or some kind of health issues very quickly without even access to hospital, because sometimes it's just impossible, or we have no time, or we have no access, or it's overcrowded. So personalized medicine and personalized tools for quick health testing is crucial for the prevention in fighting this issue.
So, considering the developing situation right now, do you think AI's most crucial use case is then to help manufacture preventive medicines and prescription drugs?
As a patient, as a person with a chronic disease, I would say that we actually need machine to develop medicine. It's my opinion. Because, for instance, I personally use medication from 1960s, because since this period, companies didn't produce anything better. In most cases, we just make money. And we really need machines and AI to build a healthcare driven by actual research, actual result and efficiency, not just because with medicine it's easier to sell, because it's trendy, and you can go to the mainstream and make more money. We need actually data to define appropriate ways to treat problems. I'm not an expert in medicine, but as a patient, it's my perspective, because I collaborate and I talk with different communities, a different association related to particular chronic disease, and they actually believe in technology, and they actually not really happy with what we call human approach, but in a bad way, because it's really far from actual data-driven approach, and it's not really close to patient needs. And I believe that coronavirus is a similar case.
Yes, so with all of these factors that you mentioned, how AI can help prevent such an outbreak in the future, and like with the collaborative AI and everything, how far do you think this research actually is in its current stage? Because I personally believe, again, I'm no expert over here, but I've read some articles and they say it's like in a very early stage right now.
Yes, I would say it depends on particular type of solution I mentioned. For instance, when we're talking about collaborative AI and data science, it already works. For instance, as I mentioned, there is a Zindi Africa, a startup which allows to crowdsource efforts, data scientists across the whole Africa. Or we have a global project, Amdina. We will have a talk with them basically in one week very soon. So I will ask them in details about current stage. But currently, we already aggregated data scientists and AI experts around 70 countries around the world. So basically, it's already works both technically in terms of awareness, in terms of involvement. I'm already had a quick acquaintance with AI Saturdays, is an organization with building meetups of AI experts, and we build huge communities in different parts of the world. And interesting enough, that the biggest meetup we've made was in the Lagos, Nigeria. So emerging regions provide us with a huge amount of talented data scientists, talent. So we have a platform, we have a technology, we have a data. So in terms of collaborative platforms, I'm more or less happy with what we have today, and maybe a few years, and it helps us to come up with a good solution. In terms of predictive analytics, in terms of drug research, is a very open question. It's a very complicated area which require significant investments. And in most cases, when we discuss such type of companies, is about scope of investments like $100 million. Is a really kind of unicorns type of companies. And they are really far from being transparent, and it's really hard to evaluate. So I believe this particular niche far from ideal and far from transparency, and we need more progress here. And more democracy and more competition in order to come up with results. And personally, my opinion that people actually, that coronavirus touches many things about how to treat problems, because people don't care about then Theranos made a bubble. They didn't care that some startups are not efficient. And now we see that we have a problem and we didn't have a solution. And that's why we understand what we need to make our startup and our technology work, not just in terms of valuation, but in terms of an actual outcome for patient, for smart personalized cities. It actually should work, not only conferences, not only for investors, VCs, foundation, but actual people.
Yeah, absolutely. You're right that this pandemic has brought about new insights in the current architecture, and I believe that this is something that will help us accumulate even more going forward. Well, that wraps up our session for today. Thanks for joining us, Yonah.
Thank you so much.
Thanks for listening to this episode by BetterTech. If you enjoyed this podcast, give it a thumbs up and don't forget to share it across your favorite social networking platform. We look forward to bringing you the latest industry news in our next episode. In the meantime, take a look at our other episodes and hit subscribe with the links in the description box below so that you don't miss out on the latest in tech.